Obamacare got you confused? Welcome. This is a presentation by American Insurance Brokers, and today we're going to go over understanding the Affordable Care Act. Now, whether you agree or disagree, it's here and it's now. Obviously, there's a lot of debate in America whether or not healthcare reform should be here, but it is here as of right now. So we want to make sure you understand exactly what the ACA is and how you can participate. Number one, it's the law. Everyone is required to have health insurance coverage, or more precisely, minimum essential coverage, or else pay a tax penalty, unless of course you qualify for an exemption. This requirement is called the individual responsibility requirement, or sometimes called the individual mandate. The penalty for not having minimum essential coverage is either a flat amount or a percentage of the household income, whichever is greater. The penalty will be phased in, well, as we know of 2014, which is here now. If you do not have health insurance by March 31st, then you will pay $95 for each adult and $47.50 for each child, up to $285 per family, or 1% of the family income minus the federal tax filing threshold, which is $10,000 for a person who files singly, $20,000 for somebody who files jointly. In 2015, that amount jumps to $325 for each adult and $162.50 for each child, or up to $975 per family, or 2% of the family income above the federal tax filing threshold. Now in 2016, that fee goes up to $695 for each adult, $347.50 for each child, and up to $2,085 per family, or 2.5% of the family income above the federal tax filing threshold. In later years, the flat penalty amounts for 2016 will be indexed based on the cost of living. So, since you're required to have health insurance, and it is the law, do you get help paying for it? Yes, you do. And that is in the form of premium tax credits, will be available to U.S. citizens and lawfully present immigrants who purchase coverage in the marketplace and who have incomes between 100 and 400% of the federal poverty level. In addition, to be eligible for the premium tax credits, individuals must not be eligible for public coverage including Medicaid, the Children's Health Insurance Program, otherwise known as CHIP, Medicare, or military coverage, and must not have access to health insurance through an employer. There is, of course, an exception in cases when the employer plan is unaffordable because the employee share of the premium exceeds 9.5% of the employer's income. There is also an exception in cases where the employer plan doesn't provide a minimum level of coverage. How do premium tax credits work exactly? It's simple. The amount of tax credit you may receive depends on your income and the cost of the marketplace health plans in your area. The marketplace will determine the expected contribution you're required to pay toward the premium for a mid-range silver benchmark plan. The expected contribution will increase on a sliding scale based on your 2014 income. The difference between the premium for the benchmark plan and your expected contribution equals the amount of your tax credit. The credit cannot be used to pay for a catastrophic plan. Here is an example of the federal poverty level chart and what they use to determine whether or not you qualify for a tax credit. And that level ranges from 133% to as high as 400% based on the federal poverty level chart. So in other words, you could receive a premium percentage of the household on a sliding scale from 3% up to 9.5%. So what income is counted in determining my eligibility? Well, eligibility for the premium tax credit is based on your modified adjusted gross income, otherwise known as MAGI. When you file a federal income tax return, you must report your adjusted gross income, which includes wages and salaries, interest and dividends, unemployment benefits, and several other sources of income. MAGI modifies your adjusted gross income by adding to it any non-taxable Social Security benefits you receive, any tax-exempt interest you earn, and any foreign income you earn that was excluded from your income tax for purposes. Note that eligibility for Medicaid and CHIP is also based on MAGI, although some additional modifications may be made in determining eligibility for these programs. Contact your marketplace representative or your state Medicaid program for more information. Now, what exactly does household income mean? A household is determined by all individuals living under the same roof who earn an income and are associated by marriage or dependency status. So if you live with someone and are unmarried and do not file jointly on your taxes and cannot be claimed as a dependent on anyone else's taxes, then each are treated separate for the purposes of determining a tax subsidy, even though they may live under the same roof and have the same address. Now, if you are married, however, then you must file jointly in order to be eligible for a tax credit. If a child lives outside of the home but is still being claimed as a dependent, then that child or child's income will also be considered when determining a tax subsidy. So what the heck are bronze, silver, gold, and platinum plans? Well, quite simply put, the level of metallic plans on or off the exchange determine the percentage of responsibility that you would have to pay. So if we're looking at the bronze plan, the bronze plan is a 60-40 plan. So once deductibles are met, the plan pays 60% of the medical expenses and you as the insured pay 40%. Moving up the scale or down the scale in this sense, the silver plan jumps to 70-30, which leaves you less out of pocket. Gold goes to 80-20, and platinum, being the best plan, covers 90% where your responsibility is 10%. Now, you may also qualify for cost sharing reductions. If your income is between 100% and 250% of the federal poverty level, you can also qualify for cost sharing reductions. These will reduce the deductibles, copays, and other sharing that you would otherwise apply to covered services. The cost-sharing reductions will be available through modified versions of silver plans that are offered on the marketplace. These plans will have lower deductibles, copays, coinsurances, and out-of-pocket limits compared to regular silver plans. Once the marketplace determines you are eligible for cost-sharing reductions, you will be able to select one of these modified silver plans based on your income level. Well, this all sounds great, you may be thinking. But maybe you don't want to buy a government plan. Well, contrary to myth, when you enroll in a plan on the marketplace exchange, you are not purchasing a plan from Uncle Sam. You are actually choosing plans from several well-known and established insurance companies who have been providing traditional health insurance for years, and in some cases over 75 plus years. Also, the government does not determine which providers you can go to. That is solely determined by the insurance provider and their established networks that they have already in place. You can rest assured that you can pick plans from national carriers such as Aetna, Cigna, Humana One, Assurant, Blue Cross and Blue Shield, United Health One and United Healthcare, and of course Anthem, and as well as many other carriers that are nationwide and some that are also local to your area. Sounds good. Now how do I know if and what I qualify for? First off, we highly recommend that you get with a licensed American insurance broker agent so that you can rest assured that you will have a smooth transition from beginning to end. The last thing you want to do is go to healthcare.gov and try and figure this out on your own. You will be overwhelmed and will have so many options to choose from and may not fully understand what it is that you are buying from the exchange. Not to mention, you could potentially cost yourself hundreds of dollars in the end by not picking the right option or by not figuring out the proper subsidy. You can, however, find out in just a few clicks whether or not you might qualify for a subsidy and what providers and networks are available in your area. I will show you an example of how you can use the healthcare.gov website to find out fast. So if we go to www.healthcare.gov, When you get to the site, all you want to simply do is click here where it says See Plans Before I Qualify. And when you click on that, you're going to see right here I'm looking for coverage for myself and my family. What type of coverage do you need? You can click on health insurance. What state do you live in? I'm going to use my area just for an example. Pick the county that you live in. State your age. And just for example, I'm going to put some fictitious information here to show you a basic family of 4. When you scroll down to the bottom, is employer coverage available to anyone in this household? Most likely, if you hear, it's no. And again, even if you do have insurance available through work, but it's more than 9.5% of your income, you can still qualify for the exchange potentially. And then of course the important thing is, what is your household's expected income for 2014? Now remember, we talked about that term MAGI, Modified Adjusted Gross Income. So let's say with this family here, at the end of 2014, based on the previous year's taxes, the modified adjusted gross income is going to be somewhere around the ballpark of $55,000. And this is for a family of 4. Simply click on Check if I can get lower cost. When you click on that button, it's going to tell you a little bit of a synopsis here. Eligible for Medicaid and/or CHIP. So what it is telling me here is that persons 3 and persons 4, which are the 2 children under this plan, are eligible to apply for the CHIP plan, which means they would be excluded from the exchange. So you would only have to, in this case, get a subsidy for you and your spouse. And the children would most likely qualify for the CHIP plan at either 0 cost or a percentage, again based on your income. Now if we change this and we modify this according, let's look at 75,000. So if we go up high enough to where the children are not in the CHIP status, it'll tell you right here, eligible for help paying for coverage. This group is probably eligible for a premium tax credit. Let's drop down to 65,000 and see what happens again. Same difference. So you can kind of see where the cutoff mark is. Let's see if it's 60,000. There you go. So it looks like around 60,000 is going to be the cutoff where the children aren't going to be available for the CHIP plan, but they would be eligible to get a subsidy and go on the exchange with you. All right. Now, you want to make sure that you are as accurate as possible on this number. You don't want to lie, you don't want to inflate numbers, and you don't want to, of course, deflate numbers, because based on the accuracy of your numbers at the end of the year, you could potentially have to pay back the government subsidies based on what you reported initially. So now that we have established what your MAGI is, you want to click on View Marketplace Plans, and this will give you an example. Now again, you don't want to click on Apply, and you don't want to go at this alone, because it's going to be hard for you to decipher the 54 plans that are here, exactly what each plan does and how exactly it works for you. But if we click on Silver plans here, for example, which are the baseline plans, it's going to give you examples of what the deductibles are per individual. So as you're seeing here, you can get a plan for $1,500 deductible per individual, maximum out of pocket per individual of $63.50 a year, $4,500 for the entire family, which is basically 3 deductibles, and $12,700 out-of-pocket maximum for the entire family, which is double the amount here. Some plans come with doctor's visits, some don't, some are based on deductible. That's why you want to make sure you check with your agent and have him or her go through all of the scenarios with you and make sure that you qualify for the appropriate subsidies and can explain all of the plan details in full detail so you know exactly what you're getting. And this shows you here, based on a family of 4, at least in this county, you could still earn $60,000, and on a plan that would normally cost you $922 a month without a subsidy, you can get for $399 for your entire family. Okay, So again, it's based on accuracy of numbers, and that's why it's important that you get with your agent so that you can understand exactly what it is or what it is that you don't qualify for. So now that you know, contact American Insurance Brokers today, and we can walk you step by step through the complete process. It won't cost you a dime extra and could very well save you thousands of dollars a year. Take comfort in knowing that our agents have a professional background in health insurance and have completed extensive training on the Affordable Care Act, how the plans work, and what the rules and guidelines are. Contact American Insurance Brokers today. You can reach us at 1-888-589-2220. Again, the number is 1-888-589-2220, or simply visit us on the web at www.aibexchange.com. www.aibexchange.com. Thank you for visiting American Insurance Brokers, protecting your way of life.